probably heard that Melbourne is the most locked down city in the world, and it's not been easy. But today, we're zooming in on the silver lining that comes with overcoming the toughest challenges. We're celebrating the resilience of community and the individuals who live and work in the community. It's been a tough time for community, for the leaders, the elders and the mentors. But I think there's something comforting in that, because it reminds us that we're not in it alone, to know that even the people we look up to have faced big challenges. Not everyone is 100% strong 100% of the time, and that is okay. That is what resilience is all about. So I'll be talking to a group of speakers who live and work in our community about their own stories during the pandemic and learning about how they recovered after a tough time and how they are helping other people to come back stronger and more resilient than before. This is a podcast about serving the community and living in community during this once-in-a-generation pandemic. Let's do it.
Hello, my name is Quinn Taylor. My role is a Community Wellbeing Officer at the City of Yarra Council. I help with the digital literacy and the food relief.
Hello, my name is Maryan Muhammad. I work with North Richmond Community Centre. My role is mental health concierge.
Hello, my name is Faiza. I'm one of the nurses working for high risk accommodation response team at North Richmond Community Health Centre. So my role basically was just reaching out community to come get vaccinated, especially my community, because they were very hesitant.
Hi, I'm Conor Sibly. I'm a community development worker working for Belgium Avenue Neighbourhood House. I'm working on the North Richmond Community Capacity Building Initiative. I was also lucky enough to work 1 day a week with the wonderful Hurrah team. So Brendan and Laura invited Sally and I to be part of the team, and it was great to be a part of that kind of first response.
Hi everyone, my name is Achut and I work as a mental health project coordinator for the public housing estate. So we support residents in North Richmond, Fitzroy and Collingwood.
Can you describe for us a difficult situation you were in during lockdown and how you managed to pull yourself out of it?
So during the whole lockdown experience, I was in the same situation with being unemployed, and that took a toll on my mental health, having to be stuck inside and experiencing the many different levels of the lockdown procedures that we had to go through as a state. I really took on the mentality that I was imprisoned, but it was at my own home. So I had to, work towards myself to get out of that hole that I was in. And that's when I started to reach out for services within the community or what was out there to try and save myself from being stuck in this mental hole that I was in.
Yeah, lockdown was not easy. It played with our emotions a lot, especially, being stuck at home, homeschooling the kids. I used to work I was an aged care nurse before I worked in North Richmond. Gave up my aged care work because I was scared my kids or I would catch COVID and die from it. So I quit my job just for the safety of my family and for my kids, and it was very hard just being stuck at home. It was very hard time. Especially living in the high rises where you'd got no fresh air, just basically you're locked up. You can't go out to just have fresh air. Obviously, it's a high rise. You'll get scared you'll catch COVID because you're sharing lifts and laundries and all of that. Got helped. I didn't take no medications for it, but just meditation and just going for walks just helped me. Reading, just taking it easy,
For me, I think what I thought really interesting about COVID was that everyone was impacted in some way, and I think I quite often minimise my experience because I think working with people that live in public housing, I quite often minimise my experience. I said it's okay, I've got this, but I think that everyone experienced something differently, and I think that it was really like a roller coaster throughout the whole time. And I think everyone had unique experiences. And I think for me, I felt lucky that I had a full-time job, but I was also studying, and I really struggled, I guess, in terms of having a lot to do, but then also, losing a big part of who you think you were. Because I think during our lockdown, we lose our connections with our friends and our family. So we're constantly thinking about who we are now. I think that was really interesting. So I started connecting with things in terms of creativity and like learning how to play the piano. And everyone experienced different things, but I think it really exacerbated some of those kind of disparities within our culture, or so I think people living in public housing experience things a lot harder in terms of being locked down in really small units and overcrowded conditions. And I felt guilt about that because I didn't have that same experience, but I was working with people that were experiencing that and felt powerless to kind of shift or help people that were experiencing that. So I think it was quite a unique experience. And I think the last lockdown for me was probably the hardest. Because it's just never ending. I don't know, when will we get out of this? But
I couldn't cope with the curfews. So usually I like to do my stuff, in the evening, or going to the gym. I was going to the gym quite often, 3 times a week. And then when the gyms were closed, I really struggled to stay, fit and do physical exercise. I went on walks and stuff, but after that I just lost the motivation for it. I think what I did wasn't a good habit, but at the same time I found myself staying up till 3, 4 a.m. in the morning just watching Netflix and eating popcorn. It wasn't, I don't know why. I just struggled really, with lockdown. I didn't think it will impact me that much, but because I thought, this whole pandemic is going to end within 6 months or 1 year. But then when it just kept dragging on, I just, couldn't really cope.
I was driving everywhere in Melbourne, reaching out the community. I was in working community aged care. So going home to home, helping elders. And I felt in myself that time I have to do something. Instead of thinking only myself, think about others who are not able to go out, who is don't have the power that I got. And I was felt that it's my time to help people. And I was doing 5 days, 5 to 5. And that helps me to reduce my stigma and feeling powerful to help people. It was hard not able to see my friends, and in Australia it was not allowed visiting because I live in high rises. All that impacting, but I was putting others in front, not myself, and that helped me. And I know if I do that, it helped me a lot. Yeah, it helps you back. I know whatever you pay, it comes back to you. So
it's kind of compassion, basically.
Yeah.
And some people find joy in compassion.
Conor and Quinn, you both worked with culturally and linguistically diverse communities, particularly older generations, to enable them to become fully fledged smartphone users, laptop users, that kind of technology. Why is it important that this particular group get upskilled in this area, particularly during the lockdowns?
Yeah, I find that with the older generation, in terms of my experience, that lack of understanding of digital literacy and the digital knowledge on the smartphones they hold in their hands, most of your shopping nowadays, or if you are relying on on the government in a sense, and now acting towards most services being online. And so not having that access really limits you into how you can progress why it's important for the older generation to have that knowledge is so that it doesn't put families in positions where not only do you feel isolated, but it puts a lot of burden on the family members themselves in terms of the younger generation to having to keep up or to teach their parents. So having that ability to communicate online and having that knowledge is key to having that stability with family, and that's something that I've been wanting to progress.
Yeah, I think with COVID, another really interesting thing was that everything shifted online, but I think it was we really left a lot of people behind in that process, because I think with people we were working with and that live on the housing estate, a high proportion are older Vietnamese and Chinese communities that don't have smartphones or don't have the internet. So I think digital inclusion was really exacerbated, I think, throughout COVID, and that's something that I was really conscious of in the work that I was doing. I was on a lot of reference groups and advocating to the minister's office and all types of things, really trying to get free Wi-Fi on the agenda, which has been a really long and political process and may never happen. But I think some of the really good outcomes of this were the partnerships that formed. So Yarra Libraries and Bush Adult Education, we work really closely with them to kind of try and develop programs and get access to digital devices and dongles, and so it was a nightmare actually, and it was one of those systemic processes that you're banging your head against the wall, because it's like how do we get people access to devices? How do you teach them how to use them when they're in lockdown and they have to speak another language? Like, I think there was so many barriers and obstacles to digital inclusion, and I think the organisations and a lot of the community members that we worked with were just so resilient and incredible to be able to deliver these projects. And it was, and I think just being able to see the change within one person was really exciting as well, because I think we saw people, taking photos of QR codes, thinking that they'd checked into a business or whatever. But I think it's just the little things like that, teaching people how, But I think I don't know what else to say, but I think it's really important, because I think in terms of access to health information and those types of things and keeping social connections is really important. And I think that creative arts is what got us through. A lot of people that had access to technology, creative arts was what actually got us through. So it was Netflix, it was music, it was whatever. So I think that investment in creative arts is really important, because it gave us a lot of mental health support.
So I have a very fun success story in regards to digital literacy. In terms of the functionality of how an internet dongle works and the process behind even setting one up, it was even confusing for us, and we're pretty, literate with the, digital literacy. So, and I just remember this one situation where they were a family, I think it was a grandmother and their either granddaughter, or they didn't have internet at home, and the child was going through school, was doing online schooling, and she didn't have internet. So I went out of my way to get this plan going for the internet, have it set up for the household, visiting the household itself and introducing myself, which was quite rattling in a sense. But after getting it all set up, writing the instructions down, like word for word, so they could follow the exact instructions, how to connect to the internet and how to disconnect, because at the same time it wasn't unlimited. And I think that's probably one of my biggest accomplishments in terms of serving the community, but also sharing that knowledge of my digital literacy skills.
I might just add that I think I know the family that Quinn's talking about, and I happened to see the grandmother on a Zoom call, and that made me really excited that she was able to get on the Zoom call and and was able to communicate with everyone. And it was a Vietnamese woman, and it was a focus group that we were running, and she was able to communicate with an interpreter. So I think, yeah, it was really lovely to see that was that next step of engagement online. So.
And you live and work in the community. How resilient is our community in wanting to keep safe during the pandemic? And do you face any challenges in your work? And how do you overcome them?
How resilient. I think the community has been very resilient. They've kept up, especially, seeing what happened in Flemington. They were scared same situation would happen, and they would get locked up and get no freedom, which was not fair, whatever happened in Flemington high rises. I think they were very scared. But what we did was we made sure that's not gonna be the case. Which was, very interesting. And I've had a couple of challenges in working with Hara, especially people not English being their first language, or and I've overcome that with, because our team, we've got like most of our team speak another language, so just by the team helping me to, if I needed help, they would just come and translate.
Just as a general question, we have, of course, a very diverse community. What do you think was going on for them during those 6 lockdowns? Was it 6? Yeah.
Something like that.
Yeah.
Emotionally, I think, emotions were high. People didn't know what to do, especially, because COVID had so many rules. Obviously, the government was coming up with curfews. People didn't know what that means. Some of them will go out and get a fine. Obviously, you were not allowed to travel more than 5K in some cases. And especially, for my background being a Somali Muslim, there's not a lot of halal butchers around. So that closest one would be like Footscray, Sydney Road. And, if you go more than your 5K, you'll get a fine, most likely. And, it was very challenging for them. It was very hard. But, I think, that we've overcome. They're very resilient and, good community.
Yeah, I think one of the challenges, a lot of the African community, were very hesitant to the vaccine because, there's a lot of conspiracy theories that were going on. And at times when we were out there doing outreach, they were thinking maybe we were going to some of them thought that maybe we're going to be forceful or aggressive with telling them you do need to get the vaccine. I'm like, no, we're here just to give you information and take your time until you feel confident that you want to take it. But I think during the second lockdown, I've seen, a few African, elders booking their vaccination and coming here. I particularly helped older South Sudanese lady come and get her vaccination on, just helped her with language. Yeah, and it was just really, for me, an exciting moment to see the shift. Yeah, from we don't need this vaccine that the government is telling us to get, to, maybe this is the only way out,
Yeah, so during lockdown, I guess when it first started, we were kind of what do we do? Because I think we were all confined to our houses, but through the neighbourhood houses, we were allowed to provide food relief under the regulations. So we started doing weekly food relief. And we wanted to try and deliver that with dignity, I think. So it wasn't just food relief. We tried to create a bit of a market where people would come to us and they'd have selection of what they could get. So we had a food pantry and we had bulk items like rice, and really tried to make sure that it was culturally appropriate. So each week we were asking people what they wanted, and fresh produce was a key thing. And and it was quite interesting with some of the different communities. Like Achut was saying, we struggled to engage with some of the African communities. So we were lucky enough to have Fatuma on our team, who's a Somali woman who started doing deliveries to some of the African families and trying to engage with them through that way. So I think it was quite a interesting way to engage with the community when everyone was in lockdown, was through food. And we did an international cooking program where we shared recipes and cooked together. So I think I think it was a nice way to kind of keep in contact and through sharing recipes and cultures. Yeah.
Okay, we're out and about in community and we're asking people what they think resilience means to them and how they've been handling the lockdowns over the past couple of years.
Hello everyone that's listening to this podcast. My name is Thuc and I'm a resident of the Commission flats in Richmond. Personally, I was in one of the lockdown building, the 139 building, and I couldn't go outside for an entire day, staying inside. Like the scene was quite shocking at first, but like myself and the other members of the community trusted the government, we trusted the professionals, so we all got tested and we all got the vaccine when it was necessary, and together we're helping Victoria come back to what it used to be, like a non-lockdown world, non-COVID, reduced COVID world. And I'm very happy about these statistics and very happy regarding my community and what we've achieved.
Okay, we're back in the studio with our guests, and I'm curious to ask, do you have any stories about your programs, about how they're helping people to come back stronger after the lockdowns? Are there any success stories you can tell us about?
Yeah, like especially Yarra, like we've I think this morning this is from Brendan, we've been nominated for some award or something. Which is exciting. I can't remember the name of that one. Sorry. Yeah. We became the fifth finalist or something. We've done a lot for the community, especially, during lockdown. And so we would do like checking calls. If they don't answer, we'll go door knock their house, make sure they're all right. We've had couple of people that we had to call ambulance for, obviously. They were like not okay, or they were on the floor. Yeah, yesterday I was vaccinating this old lady that came all the way from Geelong, and then she was like, "Oh, everyone in this community is fully vaccinated." And I was like, "Yeah, I'm one of them. I'm one of the nurses that was helping." Everyone's like, "Oh, well done." She was getting her booster. So everyone knows about us now. We're famous.
And we felt like Richmond people so helpful in our team. We had masks around, hand sanitizer, information about, COVID vaccination, and we really happy to get a vaccination on time. And we never missed any information we needed. And they was around like up and down everywhere and helping the community. And we're really happy that we have you in Richmond compared to other, places where it's lack information, lack of hand sanitizer, lack of mask. So we're so helpful in Richmond having in our team. Thank you, guys.
Yeah, I'd probably just like to add that I think some of the partnerships and connections that have been established through COVID, I think, is a lot of the local services really banded together to kind of try and deliver services and kind of advocate for different strategies, I guess. But yeah, I think that the connections that were made through community and the great work that Yarra did, and I think, just some of the partnerships that were really incredible. Like now North Richmond Community Health and BANH have got really good partnership alongside other organisations and Yarra Libraries and Cultivating Community. Like there's just so many amazing organisations that are operating within the estate, and I think that's a real credit to everyone.
So in light of the discussion we're having around COVID-19 and the big impact it's had on the way people feel, I just want to ask a question about mental health. With culturally and linguistically diverse communities, what do you think they hear when they hear the word mental health, and are there any misconceptions?
Yeah, actually, when I saw the question, I was actually, I got excited because at the moment we're serving communities, like in the 3 states. And we have that question actually in our survey, like, what do you think when you hear the word mental health? And we got like mixed, answers, where some people say they hear like sadness, loneliness, and depression. Some people think, it's just stigma. They, whenever they hear mental health, they just think of stigma, and some people think of a crazy person. So yeah.
Yeah.
I think yes, a lot of people who come in Australia recently and they experience trauma and a lot of unpeaceful situation where they come from, coming here, they don't know what it is, and they just thinking someone naked and running in the street. If you say what is mental illness, they don't know anything else rather than that. So you have to be naked if you are having mental illness and running in the street, and you don't know what is good or bad. So you just whatever comes in front of you, you put into your mouth, no matter what it is. That's what they think in number one. And some other people run away if you mention.
Yeah.
If you mention their name, they run away. They're not talking to you even. So they just afford you to answer. And some people will think about, like I was doing yesterday, and they thinking taking tablet is number one.
Yeah.
That's the only solution they thinking. If you ask them, they say, yeah, taking tablet is about depression or mental illness.
Yeah.
So it's really hard topic, and people will scare more, and lack of trust, lack of, information, and people will need more, confidence to talk about and know what it is, what level it is. And the only scary they thinking, if you say I have a mental illness, you get treated in hospital and put it on medication, and there is no other solution.
Yeah, and I also just wanted to mention, there's always, mental health and mental illness are completely different, and so sometimes people think, when you're saying mental health, they think you're saying mental illness. So mental health is just the general well-being of the mind, and mental illness means that you have an existing, condition or something like that. Yeah, and I just found it interesting. I remember when Maryan was saying what mental health means to you, like naked person in the street walking. This is actually a direct quote from a woman who were doing outreach in Collingwood Neighbourhood house. It's actually a direct quote from a woman who told us this,
It's really sad, there is no other way they know. And we like to, pass information around and help as much we're able to do and reduce this stigma. And, it is not like no one forcing you. If you say, I have mental illness, no one forces you to do something you don't like to do it. And there is so many ways you will able to manage in your situation. And there is help around if you need it, no one forces you. I will say that.
Yeah, I'd like to hear what other people think as well here.
Yeah, people are scared to come forward because they think they'll be, they'll lose their job or, being stigmatized or, people see them as that crazy person, especially in the African community, for example, if a mother's got a son with mental health, people say, oh, she's got a crazy child, which is not the case. It's very, I think it's to do with a lot with the culture.
What is resilience as a trait in a mental health profession? How do you describe it in the people that you see?
Yeah, I want to start by actually saying resilient in psychology is not seen as a trait. It's actually a life skill. So it's something that you can develop, and over time, with role modeling, for example, children who see their parents, how they cope with, life stresses and something like that. They end up, if they don't get enough emotional support from a young age and just be allowed to express their emotion, then they'll find it hard to cope in later life. So it's just, resilient is how well you cope with life stresses and trauma and just things that happen in your life, like how can you make it, and overcome these challenges. Not saying that you should not feel complete, going to a dark hole or something like that. You would feel all of that, but it's just how you're going to overcome this and not feel stuck. Yeah. So I think, like the advice I'd give for people to, to just have good connections around you, practice like healthy thinking, and healthy thinking, it can actually, it can be developed. Like I grew up, in a way like with very negative parents, and always like just the negative talk was the one that's like I grew up with. So when I was an adult, I was mostly just negative talking to myself. And then after seeing a counselor and things like that, I remember I woke up one morning and I'm just realized that I'm not thinking so negatively.
Yeah.
So it's just something that you can't develop, like the patterns in the way you think, like just healthy thinking, and just, connections, like really good connections. And just to develop your resilience. So it's not, something that one person is born with and the other is not. It's a life skill that you can, improve and develop.
I like that as a correction. It's not something inherent, it's something you have. It's like a skill that gets better and better the more you use that skill. Yeah.
Yeah, I really like that. I think that's lovely. I remember talking to a community member about lockdown, and she said, I've been in refugee camps, this is nothing. So I think for other people, this was like, for Australian born people, maybe lockdown was like, this is a resilience type testing, character building experience. So I think, that was really interesting.
Yeah.
I agree with you that because I was in that position. I'm from Kakuma refugee camp, and since I born, my country was civil war, killing one another, and this was like nothing for me. I was thinking, why people frustrated because I have more than that. So
And
it
the
was like
panic
easy.
buying.
It was easy for me, really. And I was like saying, remember, powerful. And people, I was thinking, you have a house, you have electricity, you have money. Why are you thinking like this? You have to thank you for what you get it for. Because, imagine back home, nothing like this, no one help you. Only they shoot you. They kill you. There's no treatment, no money, no electricity, no water. And, I was in refugee camp, and there's nothing like in here. And I was like, this is really easy compared where I come from. So I agree with that.
Yeah, I guess it's different. And like, that's not to take away like different people like experiencing different things. For some people, for example, children and other people, was really hard. However, I think a lot of the people who come from like very difficult situation and like a refugee background, they found it really strange for like, for example, for white men to talk about wearing a mask while you're taking my freedom, and some people just found it very trivial. Like you're talking now, you want to talk about human rights about a mask, and it's So it was strange for a lot of my aunties making jokes about like all these white people, being crybabies about, like a full lockdown or like, wearing a mask.
I can really imagine that. Yeah. It puts things into perspective. Yeah.
Maybe just to follow up on what Achut was saying, I think in terms of the mental health, I think breaking down some of those male toxicity is really important, because I think men quite often don't talk about their mental health. So I think tearing down some of those kind of behavioural or male toxicity is a good thing, because I think we all can be vulnerable, and to talk about our mental health is really important.
Yeah, definitely. I wholeheartedly agree with you, Conor. It's one of the things that I had to battle with during the whole lockdown situation back in 2019 to 2020 was, that I was fighting with myself to the fact that was I going to be weak if I reached out for help, as a man, because I'm in a situation where I don't live with parents, I'm living on my own and having to, find my start in life, and having to battle with, how will this affect my, how will this affect people view me as like, being a man if I went out for help? Like, will they see me as weak, or, will I be in a situation where I wouldn't be liked because now other people will know my weaknesses and now they will take advantage of me? And it was like the other voice that I had in my head of, protecting myself. And I think that's one of the biggest ones with mental health is distinguishing or even just getting rid of that voice altogether of not being a man if you reach for help. And I'm glad that, I was able to push through that and find the help that I needed, because I don't think I'd be in this situation here currently, or even just the opportunities that I've had this last year, if it wasn't for myself to, really reach out and just share my story. I, happened to stumble upon Headspace.
Yeah.
That's one of the biggest organisations that's helped me a lot go through, my mental health journey and really just improve myself. There's other services like the Fitzroy Youth Centre. They have a lot of youth workers there that really provided that support with, my home situation and also my finances as well. And just also like my general well-being and being able to communicate with someone. I'm really proud of myself for that, for being able to, have that strength to reach out to people and build that connection.
Coming together like the women's circle, some women are just stuck at home with the babies, coming together and doing those kind of activities, helps their mental well-being, and it's good. Especially I know because I'm a mom. I used to be a mom,
You used to be a mom.
I had kids. Yeah. No, I had kids, being a first-time mama or, just staying home, sucks, especially with your mental health,
It does.
I just want to add as well, is one of the things I've been trying to advocate is connection, human connection, and just interactions. We've had that lack of interactions on a human level for the last 2 years, nearly 3 years now. I really just want to reverse that now. Let's end this on a
I agree. Yeah, I think connection is really important, and it's actually one of the most important component to building resilience. If you're not having meaningful connections with humans, your resilience is likely to be low. So they tell you to get out there, connect with people. And I think we need to encourage people here in the community to just come to things. What do you have to lose? You come for 1 hour, 20 minutes, 30 minutes, and if you don't like it, you can leave. No one's going to force you to stay.
Well, at least there's that opportunity.
Yeah.
At least we have these out in place for people to, slowly ease into it.
Yeah.
Now there's, a lot of people still with that social anxiety. Of course, that would have developed during this whole lockdown period of us being stuck at home. But now that we've officially opened up, hopefully this would be the last lockdown we've ever experienced.
Hopefully.
Now that we can really open up programs, open events, we could start doing the markets again like we used to. Well, we've missed that, the lantern festivals.
Yeah.
Just also
I've missed festivals, to be honest. I'm a huge festival goer. That's one thing I've missed during lockdown. And just creative art. Yeah.
Thank you to my guests today, Maryan, Achut, Conor, Faiza, Quinn, and our guests we heard on the Vox Pop, Thuc. Thank you for sharing how you develop resilience and how you recover quickly from difficulties. I'm sure it'll be helpful to a lot of people. And once again, thank you for listening. Take care of yourself and others, and I'll see you in the next episode.